Hello friends, welcome back to my channel Medicine Up on Zero. Today we'll talk about mitral regurgitations. Okay, so before starting the topic, let's have the idea about the what do we mean by regurgitations. ऐसे कि मैं पहले भी बता चुका है कि दो टाइप का चीज़ें हम लोग को देखने में मिलते हैं कि स्टेनोसिस एक क्या है regurgitations. So स्टेनोसिस मतलब क्या होता है जब हम लोग देखता हो वहाँ पे क्या जब valve प्रॉपर्ली क्या ओपन नहीं हो वो पता है whenever the valves they will be not able to open properly, those type of the conditions known as what stenosis. So stenosis means we can say in terms of the whenever the valves are not able to open properly. In the same way, how can we define the term regurgitations? Regurgitations means whenever the valves they are not able to close properly. Now see, as we know that during ventricular contraction, see whenever the ventricle that will contract, that means we can say the ejection phase of the ventricular contractions. At the time, the aortic valve that will be opened, and what the mitral valve that will be closed. So if we see whenever the left ventricle that is contracting at the time, if we see the ejections of the blood through the from the left ventricle through the aorta to the systemic circulations, but in this time, if we see there is not proper closing of the mitral valve, as a result, there is chances of the backflow from the backflow of the blood from the left ventricles to the left atrium, and this type of the condition is known as what mitral regurgitations. So regurgitations means we can write it over here as the valves are not able to. Whenever we will see the valves, for example, we are talking in terms of the mitral regurgitations, we can write it over here. The mitral valve, okay, can't close. Or we can write it over here. Mitral valve isn't closed properly. So what are the reasons? We'll talk about all these things in details. Wait a minute. Okay. Now in this try to understand whenever the mitral valve is not able to close properly, as a result we will see that whenever the during ventricular contractions, or ventricular systole, we will see the blood from the left ventricle, the blood that will reach to the left atrium, and this type of the thing is known as mitral regurgitations. Okay. Now, what are the etiology? What are the causes? To understand these things, we have to know one thing that is known as what is mitral apparatus. What is mitral apparatus? Now, if we see in terms of the mitral apparatus, whatever the thing will get. See, within the mitral valve, we'll get a structure that is known as what? This is the fibrous ring. After the fibrous ring, we'll get what this is the mitral leaflets. After that, we'll get the quadrilateral. Then we'll get the papillary muscles. And at last, we'll get the papillary muscles. That the papillary muscles are getting attached along with the what myocardium part. Okay, so we can write it over here. What do we mean by mitral apparatus? So mitral apparatus means we can write it over here. First, the myocardium part along what we will see, the myocardium part along with what the papillary muscles are attached. Okay, so we can write it over here like this. The myocardium. Okay, myocardium part where we'll see the papillary muscles are attached. Papillary muscles. Second, we'll get the papillary muscle itself. This is the papillary muscle itself, right? This is the papillary muscle. Itself. And third, we'll get chordae tendoni. At number 4, we'll get what? This is the valve leaflets. This is the valve leaflets. And at last we'll get this is the fibrous ring. This is the fibrous or ring. Fibrous ring. Now these whole things we can see in nursing, this is known as what mitral apparatus. So within the mitral apparatus, what are the components we'll get? Myocardium. So the myocardium, that the part of the myocardium is over here. Along with what we'll see the attachment of the papillary muscles. The next part we'll get the papillary muscle itself. Then we'll get the quadrilateral. Then we'll get the what valve leaflets. Then we'll get the fibrous ring. Now, if we see any kind of the damage, and among these one structures, if we see the damage among these whole structures, okay, within one structures, then we will see that during the left ventricular contraction, there is chances for the blood for the backflow from the left ventricles to the left atrium, and that will cause the regurgitations. Now, what are the reasons for these things? We'll talk about all these things, step by step. So first, let's talk about the fibrous ring. So if we see the problem in the fibrous ring, see, if we see the problem in the fibrous ring, for example, if it is supposed to be the fibrous ring, within the fibrous ring we will get the two types of the structures. Okay, we will get inside one structure and outside one structures. This inside, inner side structure that is known as zona fibrosa. The inner side structure that is known as zona fibrosa, and the outside structure that is known as zona what? This inner side is what? I said zona fibrosa, and outside is what? Zona spongiosa. Okay, just try to remember this thing. The inner side, we can write it over here. The inner side structure that is known as zona fibrosa, and outer one that is known as zona spongiosa. Now see from here, if we get any kind of the problem over here, for example, if we get any kind of the myxomatous, if we get any kind of the myxomatous degenerations of these structures, then we can get the development of the mitral valve prolapse. The mitral valve prolapse and will develop the mitral regurgitations. Okay, now next thing, kind of the, for example, there is some genetical problem. If we get some connective tissue disorders, whatever the disorders, we can write it over here. In this way, you can write that the Marfan syndrome, where we will get in terms of the Marfan syndrome, we will get the problem within the valve leaflets over here. Okay, this will be weak. We will get in terms of the Marfan syndrome. Whatever the problem we will see in these cases within the chromosome number 15, we will get the mutations of one gene, that is, for that we will get the defective fibrillin on protein. Fibrillin on protein, that will be the defective. So we will get defective fibrillin on protein. Whenever we are getting the mutations in the chromosome number 15, whenever we are getting the mutation on chromosome number 15, as a result, we are getting the defective productions of the fibrillin on protein. And whenever we get this type of the defective on protein, fibrillin on protein, as a result, we will see this valve leaflets, they will not able to close properly. Here we can see the development of the mitral regurgitations. Along with that, okay, let's write it over here. Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. In these cases, we will get also the problem we will get in terms of the collagen. We will not get the proper development, or the abnormal collagen type 3. Whenever we are getting the collagen type 3, that is not functional. As a result, definitely try to understand this fibrous structure, they will be not able to close properly or not to open properly. Okay. As a result, we can see the development of the mitral regurgitations from these portions. Okay. So from the connective tissue disorders, we can see in this way this type of the thing. Now, if we get, for example, try to understand, if we get the left ventricular dilations, try to understand. Okay, let me show over here with the different colors. Then I think it will be easier for you to understand, guys. So for whatever the reasons, if we get the left ventricular dilations, okay, let's draw is the fibrous ring, the leaflets. Try to understand what I want to say you. I am saying you guys, for example, whatever the reasons, if we get the left ventricular dilations, whenever we will get the dilations of the left ventricle, in the same way we will see there will be the dilations of what? There will be the dilations of the fibrous ring. Dilation of fibrous ring. So whenever we get the dilated fibrous ring, whenever we are getting the dilated fibrous ring, try to understand what do you know. Whenever the fibrous ring is getting dilated, try to understand. Whenever the valve is supposed to be closed, at that time, the valve leaflets, they just what? They come towards each other, and after that just close. But whenever we are getting, try to understand, whenever we are getting the dilated fibrous rings, the volume of the fibrous ring is getting increased. As a result, whenever during the, during ventricular contractions, whenever the mitral valve is supposed to be closed, at that time the two valve leaflets, they will come towards each other, but they will be not able to touch each other because what? Because of the the dilations of the fibrous ring. So dilations of the fibrous will go. We'll see what these two. That means the two valve leaflets, they will go upward. instead of meeting with each other, they will go upward, and that will lead to the formation of mitral regurgitations. Okay, so another reason we can write it over here. That's the left ventricular dilations. Left ventricular dilation. Dilation. Okay, this is the thing. In this case, we will get the fibrous ring. The volume of the fibrous ring that will be increased as a result. The valve deflates. They will not able to meet with each other. As a result, they will just do the development of mitral regurgitation. So over here. Okay, hope it's clear for you. Now there are other reasons also: infective endocarditis and myocardial infarctions. Now the other reasons that can also cause the what? The mitral regurgitations. There is infective endocarditis. Infective endocarditis. Whenever we get the inflammations of the endocardium, see, sometimes we will see the antigens, antibody, the different kinds of the chemical mediators. As we know, the valves they are what? They are covered by the endocardium, right? So sometimes we can see there are different kinds of the antigens and antibody. They can reach up over here and they can cause the problem. They can cause the damage of the mitral valve. As a result, whenever the mitral valve that will be porous, so in this way we can say that will be porous. So during the ventricular contractions, we can see the backflow, and that can lead to the mitral regurgitations. Okay. Now another thing we can get it over here, that the myocardial infarctions. So another reasons, what are the other reasons? We can write it over here, the myocardial infarction. Now how can we define the myocardial infarctions that will lead to the formation of mitral regurgitations? Try to understand from here. As I said you guys that, see, as I said, this is the fibrous ring. From here, try to remember, if we get the development of for example, if we get the development of myocardial infarctions, and from here, if we see, that the papillary muscles, that, as we know, the papillary muscles that are getting connected along with what? Along with the myocardium part. Okay, so let's over here, whenever the papillary muscles they are getting, for example, they are getting attached along with the myocardial infarcted part. As a result, we can see also the development of, or we can say the rupture of what? Papillary muscles from here. I am repeating once again. If we see the development of the myocardial infarctions, try to understand, guys. If we see the development of the myocardial infarctions, as we know, some parts of the myocardium that is getting attached along with the what? Papillary muscles. So whenever we are getting the development of the myocardial infarctions, these infected regions that can cause the detachment of papillary muscles from its positions. As a result, we will see the the papillary muscles that will be dysfunctional, and whenever it will be dysfunctional, we will not be able to see. We will not see what? The proper contractions. So whenever we will not see the proper contractions of the papillary muscles, in the same way we will see the chordae that will be also functionless in the way. So as a result, that will be not able to maintain the mitral valve from doing the mitral regurgitations. So as a result, we can see the development of the mitral regurgitations. Okay, so it's clear. So we can see the development of the myocardial infarctions, and this myocardial infarction that can also develop the mitral regurgitation. Okay. Now, what about the most common causes? If you see in terms of the most common causes that can develop the mitral regurgitation, you can write it over here. The most common cause that can develop the mitral regurgitations. The first regions, we can say the prolapse. I have already explained in a separate video. The mitral valve prolapse, you can watch it over there, guys. Mitral valve. And what about the second? The rheumatic heart disease. So rheumatic heart disease that can also develop the mitral regurgitations. So if we see the development of the mitral regurgitations, we can just think about the rheumatic disease, because the rheumatic heart disease is one of the most important cause that can cause the mitral regurgitations. Why? See, as we know, in these cases we will get the productions of antibodies against the endocardiums. So try to understand, as we know, in these cases we will get development of mitral stenosis, right? In these cases, try to understand from here, guys, in terms of the, see, as what do we know in terms of the rheumatic heart disease? In terms of the rheumatic heart disease, we know up to now that we'll get the development of the mitral stenosis, right? We'll get in these cases mitral stenosis. This is the anterior leaflet, this is the posterior leaflets, and in these cases we'll get the mitral stenosis. Right, this is the mitral stenosis. One thing we can get the development of the mitral stenosis in terms of the rheumatic heart disease. What are the next things? If we see the rheumatic heart disease that is progressing from this valvular regions to the cardiac tendony or the papillary muscles, whenever we will see this the rheumatic heart disease, if we see the rheumatic heart disease that progress, if we see the progressions, okay, of the rheumatic heart disease up to the cardiac tendony. So whenever we will get the progressions of the rheumatic heart disease up to the cardiac tendon, in these cases we will get the cardiac tendon that will be inflamed, that will be fibrotic, and that will be shrinkage. We will get the shrinkage of the cardiac tendon. So in these cases we will get inflamed, it will be fibrotic, it will be shrinkage. So we will get the inflamed, try to understand. Whenever we will see the rheumatic heart disease that will progress from this valvular regions to the cardiac tendon, as a result we will get within the cardiac tendon what type of the changes we will see. Within the cardiac tendon we will get that will be inflamed, that will be fibrotic, and we will also shrinkage of the cardiac tendon. As a result we will see this cardiac tendon, they will be functionless. As a result ultimately we will see they will be not able to inhibit the mitral regurgitations. So for that things we will see there will be also the development of mitral regurgitation. Okay, mitral regurgitations. Okay. So what are the regions I said in terms of the mitral valve prolapse? I already explained. You can see in terms of the rheumatic heart disease. Now, what are the other regions that can also cause this type of the problem? So let's talk about those things. What are the other regions? In terms of the other regions, we can say that the aortic stenosis. Okay, aortic. Okay, let's use the different place for it. What are the other regions that can cause also the mitral regurgitations, guys? Okay, so let's talk about these things, other regions. So we can see the aortic stenosis and aortic regurgitations. Aortic, stenosis, aortic regurgitations. Now, how can it develop the mitral regurgitations? Let's talk about that thing. So whenever we see the development of the aortic stenosis, what type of the problem we will see in terms of the aortic stenosis? Let's talk about those things first. Okay, let's continue. So if we see the development of the aortic stenosis, what type of the problem we see? Let's talk about that thing first. So whenever we are getting the development of the aortic stenosis, try to understand from here, guys. Okay, let's draw it properly once again. Okay. Now see, whenever we are getting the development of aortic stenosis, in these cases we will get the narrowing of what? In these cases we will get the narrowing of the aortic valve. In these cases we will get the narrowing of the aortic valve. So whenever we are getting the narrowing of the aortic valve, try to understand, guys, from here. So this left at this what? The left ventricle, they will try to push the blood through the what? Narrowing, through the narrow aortic valve. So whenever try to understand under normal circumstances, the left ventricle that is able to push the blood from the left ventricles through the aorta, through the what? To the systemic circulation. So whenever the left ventricle, it is easier for the left ventricle. Whenever there is no aortic stenosis, normal aortic valve, at the time the left ventricle that will be able to push the blood from the left ventricles through the aorta, through the to the what? To the systemic circulations. But in these cases, whenever you are getting the development of the narrowing of aortic valve, as a result, we will see in these cases the left ventricle needs to apply more amount of the pressures to push the blood, same amount of the blood through the narrow aortic valve. As a result, we will see that there is the development of left ventricular hypertrophy. So why will see the development of the left ventricular hypertrophy? Try to understand, guys. Whenever you are getting the development of the aortic stenosis, as a result, the left ventricle needs to apply more amount of the pressures to push same amount of the blood through the aorta. As a result, we will see there will be changes within the left ventricle. We will get that hypertrophy of the left ventricle. Now, at a time, if we see the hypertrophy of the left ventricle is not able to push the blood to supply the blood within the systemic circulations. Ultimately, after that, we can see the development of left ventricular dilations. After that, we can get the left ventricular dilations. So in these cases, at first we'll get what? At first we'll get the left ventricular hypertrophy, then we'll get the left ventricular dilations later. So why just we develop the left ventricular hypertrophy? I already explained you guys. Whenever we are seeing that the other ventricle that is pushing the blood against the what? Against the narrow aortic valve, at that time we will see the changes within the left ventricle. We will get the hypertrophic left ventricle, and whenever the hypertrophy of the left ventricle is not enough to push same amount of the blood through the narrow aorta, at that time we will get the dilations of the left ventricle. So we can say we will get what? The left ventricular dilatation. The left ventricular hypertrophy, at that time during ventricular contractions we will get the much more stronger ventricular contractions, right? We will get the what? We'll get a stronger vector. We'll get stronger vector. We'll get the stronger vector over here. So whenever we're getting the stronger vector in these cases, try to understand. So whenever it will contract too much to push the blood through the narrow aortic valve, at that time this much pressure that can also force what? The mitral valve to open. So for this storage, the left ventricular hypertrophy and the left ventricular dilations will get the what? We'll get the ventricular contraction that will be increased. So whenever the ventricular contraction that will be severe at that time, this severe contraction that can also force the mitral valve to open, and whenever it will be open, we can get the productions of mitral regurgitations. Hope it's clear for you. So from here we can get the development of mitral regurgitations. And the next thing, the aortic regurgitations that can also develop the what? As I said you, mitral regurgitation. Now how it develops, let's talk about those things. Now let's talk about the aortic regurgitations. Now see, when we are talking in terms of the aortic regurgitations, now see, as we know, during the aortic regurgitation, whatever the thing we'll see, this valve is not able to close properly, right? This valve is not able to close properly. So whenever it is not able to close properly, as a result we will see the blood from the during ventricular contractions, the blood that will be pushed from the left ventricles to the aorta. But whenever we will see there is the development of the aortic regurgitations, we will get there is the backward blood flow from the aorta to the left ventricle. So whenever we will get the backward blood flow from the aorta to the left ventricle, as a result we will get the volume overload within the left ventricle. So whenever we will get the volume overload left ventricle, so whenever we are getting the volume overload within the left ventricle, whatever the changes we will see, this left ventricle that will be dilated, that will be stretched. So we'll get the stretch, we'll get what? First dilated. Okay, let's draw it over here, guys, then I am explaining also. Okay, so yes, we are talking about these things. Okay, now see, whenever we will get the more amount of the what? Whenever we are getting the more amount of the blood, or you can say the volume overload within the left ventricle needs to apply more amount of the pressures to what? To eject more amount of the blood. So whenever we are getting the more amount of the blood within the left ventricle, so the left ventricle is supposed to apply more amount of the pressures to push the more amount of the blood. So as a result, at first we will get the development of dilations, ventricular dilation, along with that we will also get the ventricular hypertrophy. So in these cases we will get simultaneous ventricular hypertrophy plus left ventricular dilation. And whenever in the same way, we will get the development of the left ventricular hypertrophy and the left ventricular dilations, they will apply more amount of the pressure, more amount of the force. As that we can get the opening of what? Opening of the mitral valve. So whenever the mitral valve that will be open, as a result we can get the backflow during ventricular contraction or ventricular systole. So we can get the mitral regurgitations. Whenever it will be the mitral valve that will be open, we can get the development of mitral valve or mitral regurgitation. So what are the other regions I said in terms of the connective tissue disorders, infective endocarditis, myocardial infarctions, in terms of the mitral valve prolapse, rheumatic heart disease, aortic stenosis, aortic regurgitations. There are also some more regions you can remember also. Let's talk about those things. In case of ischemic heart disease, we can get also in case of SLE, myocarditis. Okay, I'm just saying it over here. Then no need to remember all these things, but I'll just say. So what are the other regions that we can get the ischemic heart disease? Try to understand when you are getting ischemic heart disease, if you get the development of the ischemia within the papillary muscles region, so the papillary muscles they will be not able to work properly. As a result, we can see the development of the mitral regurgitations. So in the next regions we can say over here, if we get the development of, along with that, okay, if we get the development of the myocarditis, if you get the development of the myocarditis, if you get the inflammations of the myocardium, the same way some myocardium that is getting attached along with the muscle. So whenever we get the inflammations of the myocardium, definitely some portions of the the papillary also damage myocarditis. So in the same way, the papillary muscles they will be not functionally, they will be not able to function properly. Ultimately, we can see the development of mitral regurgitations. Okay. Now at the last we can say in terms of the different kinds of the disease, we can also in terms of SLE. So SLE that can also cause the autoimmune disorder disease. This can also cause the mitral regurgitations. Okay. Now we'll talk about the clinical features, examination findings, and treatment. Okay, what are the things we'll get in terms of examinations, clinical features, and treatment. So let's talk about all these things one by one. First we'll talk about in terms of the clinical features, then we'll talk about examination findings, then we'll talk about treatment, guys. So let's continue. Now, as far as the clinical features is concerned, what are the clinical features we can get over here? Try to understand. When you are getting the mitral regurgitations, whenever you are getting the development of the mitral regurgitations, as a result, we will see backward blood flow from the left ventricles to the left atrium. So when you are getting the backward blood flow from the left ventricles to the left atrium, try to understand. So whenever you are getting the backward blood flow over here, in the same way, we will get the blood flow where within the atrium. So within the atrium, the pressure that will be increased. So whenever we are getting the development of the mitral regurgitations, we will get the backward blood flow from the left ventricles to the left atrium, and from the within the left atrium, the pressures that will be increased, and the same amount of the pressure that will be transmitted to the lungs. So we'll talk about these things right now. If we see these things, try to understand from here, guys. The same amount of the pressures, try to understand the same amount of the pressures that will be transmitted to the lungs, and whenever this, the blood will get also the accumulations of the blood over within the lungs. Now, whenever you are getting the development of the mitral regurgitations, it's very easy to understand. When you are getting the development of mitral regurgitations, the blood that will be pushed from the left ventricles to the left atrium, and then the left atrium, the pressure that will be increased. In the same way, you will see the pressures from the left atrium that will be transmitted to the lungs. Whenever we get the more amount of the pressure within the lungs, at first it will cause the pulmonary edema, and followed by we will get the what? Pulmonary hypertension. So in these cases we will get what? The pulmonary edema, along with that we will get pulmonary hypertension. Now whenever we are getting the pulmonary edema, as you know that if we will get the cough or we will get the arrhythmia, okay, different kinds of the manifestations, different kinds of the clinical manifestations will get what I have already explained in the mitral stenosis. And the next part we will get whatever the thing we will get over here. At first we got the pulmonary edema, pulmonary hypertensions, then you can get over here the palpitations. Okay, you get the palpitation. Okay. Now one of the most important things, I'll talk about those things, that thing right now. So try to understand whenever we are getting the left, whenever we are getting the backward blood flow from the left ventricles to the left atrium. So whatever the thing we'll get over here. So whenever during the whole ventricular systole, the blood that will be pushed back from the left ventricles to the left atrium. At that time, we will hear a continuous sound that is known as what? that is known as pansystolic murmur. So after the S1 and in between the S1 and S2, whatever the thing will get over here, let's write over, then it will be easier for you to understand, guys. For example, is the ventricular systole, is the ventricular systole. Okay, let's do it more clearly, guys. Or is the ventricular systole is the ventricular diastole, for example. Is the ventricular systole is the ventricular diastole. So at first, at the beginning of the what? Ventricular systole will get the productions of S1. Will get the production of S1. You can write mitral and tricuspid pulse closer. And whenever we will get the S2, we will get the S2 at the end of the ventricular systole, right? At the end of the ventricular systole. So we will get the S2. We will get the S2 at S2 in terms of A2 feet. Now try to understand. Whenever we are getting the mitral regurgitations, at the time we are getting the backward blood flow from the left ventricles to the left atrium, right? As a result, we will get productions of one type of the sound continuously during the whole ventricular systole, that is known as what? Pansystolic murmur. Now we will get the sound in what? S1 and S2. So this sound that is known as pansystolic murmur, this sound. So we can write it over here. This is the pansystolic murmur. Hope it's clear for you guys. Now, see, whatever the other features I said, we can get the pulmonary edema, we can get the pulmonary hypertensions, we can get the palpitations over here also. Okay, now how can I just examine or investigate these patients? Let's talk about those things. Now, another thing over here we have to know in terms of the S1. See, as the mitral valves, the leaflets are not able to fuse with each other. As a result, we'll get the what? S1 that will be definitely soft. Whenever the two valve leaflets of the mitral valve, they are able to fuse with each other properly. As a result, we can get the what? Loud S1. But in these cases, the two leaflets, for example, we are getting the dilations of left ventricle. Whenever we will get the dilation of what? Whenever we will get the dilated left ventricle, in further regions we will get the dilated what? Fibrous ring. Whenever we are getting the dilated fibrous rings, definitely the two valve leaflets, they will be not able to fuse with each other. As a result, we will get the whenever we will get the productions of the S1, we can say the frequency of the S1 or the loudness of the S1, that will be soft. So we will get in these cases the S1 that will be soft. So in these cases, the S1 that will be soft over here. On examinations, we can do the X-ray. On examinations, we can do the chest X-ray. If we do the chest X-ray, in these cases, we will get large cardiac shadow. And another thing in these cases, we will get, okay, let's talk about those things, but then I think it will be easier for you. Yes. In these cases, we will get the cardiothoracic ratio. Cardiothoracic ratio, that will be increased. Cardiothoracic ratio, that will be increased over here. Now, whatever the findings we will get on the X-ray, we will get the large cardiac shadow. Along with that, we will get the cardiothoracic ratio, that will be increased. Okay. And what about the ECG? Then we will go to the echo. The best investigation test, that is the what? Echocardiography. Okay. Before that, let's talk about what about the ECG. What about ECG? Now, see, whenever we are talking in terms of the ECG, what are the findings we will get in ECG? As I said, in these cases, we will get the left ventricular hypertrophy, left ventricular dilations. So, whenever we are getting the left ventricular hypertrophy, definitely try to understand during ventricular contractions, we will get the, during what? Ventricular systole, you will get the major ventricular depolarization, that the factor that will be much more stronger. What did I say? You try to understand. So, during ventricular, okay, let's use a different color. During ventricular contractions, the major ventricular depolarizations vector, that will be much more stronger, and that will be towards left side, right? That will be towards left side. As we know what? During ventricular depolarizations, or you can say during ventricular systole, in terms of, try to understand, if we get the left ventricular hypertrophy, during ventricular contractions, we will get the stronger depolarizing vectors towards left side. As a result, we will see on the left side, as we know, there is the what? AVF, augmented, this AVF, then we will get the V5, we will get the V6. In these cases, the QRS complex, especially if we just talk about in terms of R wave, in these cases we will get what? P wave, Q is R. Okay, let's draw it over here. In terms of the AVF, in terms of AVF, V5 lead and the V6 lead, in these cases we'll get the P wave, QRS complex, P wave. So in these cases we'll get the large R wave. In these cases we'll get the large R wave. Opposite to that, in the opposite side, if we just talk about in the V1 and the V2, in these cases we'll get this small. In these cases we'll get this small R wave. That is going towards from this side to the opposite side. As a result, we'll get this small R wave. In these cases we'll get the large R wave. Large R wave. And then the most important test you can do over here, there is the echocardiography. So what is the investigation of choice in these cases? You can write the investigation of choice, that will be the echocardiography. Echocardiography. Now what about the treatment? As far as the treatment is concerned, what are the things you can use over here? So in the treatment you can use first, if we see there is chances for the thromboembolism formations, then we are supposed to use the anticoagulant drugs. Then you have to use the prophylaxis antibiotics. You have to use prophylactic antibiotics, because in these cases, as I said, if we get the development of the myocarditis or the infective endocarditis for the different kinds of the organisms, bacteria, the bacteria, the virals, especially in terms of the bacteria, you have to use the antibiotics, prophylactic antibiotics you have to use. Okay, and you can use AC inhibitor. Just to treat the symptoms, we can use the diuretics. In terms of the pulmonary edema, we can use the diuretics, and we can use the AC inhibitor. So whenever we are using the AC inhibitor, they will reduce the work, the heart over here. So as a result, there is less chances for the development of the symptoms again. Okay, so that's all in terms of the mitral regurgitations. In the next part, we will talk about more in details about aortic regurgitations. Okay, thanks for watching, guys. See you in the next video soon. And if you think this video is helpful for you, please do like and subscribe. And don't forget to subscribe, please. Okay, see you in the next video soon.